Good afternoon, ladies and gentlemen. Good evening, good evening. This is your guy Dejean Talks, like Iconic Convo with
Diamond.
and Dejean Talks. So this evening we have an amazing speaker that I was actually privy to be introduced to, and I'm really looking forward to this dialogue. I think Michelle knows a little bit more that this is one of those sensitive dialogues for me because I've had family that has battled with the subject matter in which we're going to embark on today. And it was a life or death situation where they were pregnant and it was the choice between life, death, baby, or your life.
Yeah.
So this is definitely something that I'm really curious about learning more about, especially when we live in a society where we're constantly being evoked by new types of diseases, new type of health issues. But the beautiful thing about technology and medicine is we're also provided with new forms of resources and new forms of help to be able to help us direct ourselves through these processes. And today, we have Dr. John Lipman with us this evening that's going to be able to help us dissect this dialogue. It's probably bigger than I could handle, but he's a professional in it. So please, everybody, please help welcome Dr. John Lipman.
Yeah. Welcome, Dr. Lipman. Pleasure to have you on Iconic Convo. I know we spoke before on multiple platforms. However, I believe there isn't enough education out there on this subject matter. So we are going to let you have the floor. Tell us a little bit about yourself and how you ended up with the Atlanta Fibroid Center.
Well, thanks for having me on. I am the founder and medical director at the Atlanta Fibroid Center. I've been practicing here in Atlanta for the past 32 years. And our practice is laser focused on caring for women suffering with uterine fibroids. And as you mentioned, I mean, fibroids are an extremely common condition. It's the most common pelvic tumor seen in women. And it's estimated that 80% of African American women have these benign tumors. So on the one hand, it's good news that it's benign, it's not cancer, so that's good, but it can cause a lot of women a lot of misery. And unfortunately, despite the fact that we have been performing this outstanding non-surgical outpatient procedure called UFE, most women struggling with fibroids never hear about it. And that's a shame because we could save a lot of women from unnecessary surgery if they knew about UFE and how great it is.
Before we dive into UFE, let's do a little backtrack and let's just do a little cleanup with the verbiage of what we're saying because some people have never even heard of fibroids, believe it or not, right?
Yep.
Although it is a commonly used term amongst your field and your colleagues, however, some people probably don't even know they have fibroids. So, what are some of the symptoms that a
Yep.
woman, or is this condition also found in men or only in women? First question.
It's only in women because these are benign tumors of the uterus.
Yes, sir.
They're very hard and firm to the touch. They're made of smooth muscle and fibrous tissue. And if you felt them in your hand, they'd be like a rock. And that's how they cause their symptoms, by pressing on whatever's next to them. So the fibroids present themselves most commonly by abnormally heavy menstrual bleeding. It's the most common reason why a woman has a heavy period.
Right.
So that will often present them to the gynecologist or a healthcare provider. They also cause a lot of pain. They can cause urinary frequency, waking up at night, painful sex, constipation, sciatica. I mean, it can cause a whole host of symptoms, but the big three are heavy bleeding, pelvic pain, increased urinary frequency.
Wow.
Awesome. Now, as you were defining it, there was a key number that you threw out there that captivated my attention, was that 80% number that you threw out there.
Exactly.
Now that's a very high number.
It is.
Can you please, is there any insight on why it's more attractive to the melanated woman more so than the non-melanated woman in this regard?
Well, unfortunately, there's been very little research dollars spent in fibroid research, which is something that we're trying to help with at the Atlanta Fibroid Center. I just came back from our national meeting, and I made a major donor grant for fibroid research. It's so important and necessary. But to answer your question, we can get back to the research. I have more thoughts on that. But nobody knows where fibroids come from, unfortunately. But once they arrive on the scene, they grow with estrogen hormone. And so African-American women get fibroids more commonly, as I mentioned. They tend to be more numerous and bigger. And so they're often the ones that are faced with fibroid surgery. Estrogen is stored in body fat and produced in body fat. And in general, if you look at body fat distribution by race, African Americans are number one. Asians are the lowest, and they also have the lowest incidence of fibroids. Now, it's not just fat, body fat alone, but it's one of the contributing factors.
Right.
Another factor that contributes is genetics. It just genetically runs stronger in African American families. Also, vitamin D is an important factor. Vitamin D is the most powerful anti-fibroid growth hormone. It's really technically not a vitamin, it's a hormone, but it is a powerful anti-fibroid growth hormone. And so if you have adequate vitamin D, you are much less likely to suffer with fibroids. Unfortunately, we get our vitamin D through our skin, and the darker the pigment of your skin, the harder it is to get adequate vitamin D. In fact, only 10% of African-American men or women get adequate vitamin D. And so you can't pick your parents. You can't do anything about the genetics. But some of the simple things that we tell patients all the time, as far as making some healthy eating choices, we can't avoid, hormones are in the food and the water, unfortunately, but there are some hormone-rich foods that you can try to mitigate or avoid. Red meat, non-organic chicken, and dairy are the biggest offenders. Eating more colored fruits and vegetables, they have compounds in them called flavonoids, which block an important enzyme in estrogen production. So if you can eat more colored fruits and vegetables, kind of limit or get rid of some of the hormone-rich foods, exercise, eat healthy, lose that excess body fat, and have an adequate vitamin D, you can really make a big dent in your fibroid symptoms or not suffer at all.
Wow. So, Dr. Lipman, here's what I heard. And this is just to reiterate the points that you brought out here. And if you're listening, for our viewers, you have men that tune in. Make sure you're taking notes for your wives, your sisters, your cousins, aunts, etc., friends, because the pointers that he said, diet is essential. You have to go back to the basics. Make sure that you're doing your leafy greens, your color codes. Also, vitamin D. Make sure you're taking your vitamins. That's essential. I read something also, Dr. Lipman, and I wanted to confirm how true it is, that studies or research now also ties this to hair relaxers, and some have said even history of abuse. How true is that?
Well, the hair relaxers, we do know that is true. It's not as much of an issue. I've been doing this a long time. And women these days are wearing their hair more naturally. So it's not as much of an issue as it used to be back in the day. But it's absolutely true. If you look at the main ingredient that makes up hair relaxers, they are compounds called phthalates, P-H-T-H-A-L-A-T-E-S, phthalates with a P. And phthalates, basically, if you looked at the biochemistry of them, the chemical composition is almost identical to estrogen. And the scalp is very vascular. And so you're basically burning this stuff right into the bloodstream. And yes, it's extra estrogen. So any way you get extra estrogen is going to stimulate your fibroids to grow. That's why fibroids grow rapidly during pregnancy, and why they tend not to be an issue for most women once they reach menopause.
Wow.
Wow. It's interesting that you said that. So I have I was blessed enough to have 7 sisters, and I'm the only boy. Yay me. And then my older sister, upon her pregnancy, she's always complained about pain in the lower abdomen area, but could never really pinpoint to the reason or the cause, however, right? And she never had the best menstrual, similar to some of the symptoms that you just listed out a few minutes ago. However, upon pregnancy, she found out that she had this huge tumorous mass on top of her uterus, which was impacting the pathway for the child to exit out, for lack of better terms.
Right.
And it had got so severe where the doctors, they got to give you the worst case scenario, and then they got to prepare you for whatever may happen, obviously, like a good lawyer would do. And what the doctors mentioned to her was the chances of this pregnancy is the baby can be born, but you might likely die. The second issue that they had presented was, even if you survive this pregnancy, the other thing that may happen is you may not be able to have another child. For a lot of people that are dealing with this right now, apart from some of the treatments that you're going to embark on in a little bit, what are some of the things that they can do, whether they're pregnant or thinking about getting pregnant, to give them a higher chance of success throughout this pregnancy? Because if we have 8 out of 10, African American women that are going, that the chances are they might deal with this at some point of their lives. Yeah. So this might be an issue that they deal with in some form of pregnancy, one way or another. So what was some of the advice or some things that you might be able to give those particular group of women?
Well, the first thing is that while fibroids can interfere with any part of the fertility journey, from fertilization all the way to delivery,
wow.
Most women that have fibroids have uneventful pregnancies. So that's the good news. But they can interfere. And like you had mentioned, they can block the birth canal opening. They can block the fallopian tubes to prevent fertilization from happening. They can cause preterm labor. They can cause miscarriages. They can cause the demise of the fetus early on. So while they can interfere with any part of that pathway, most women with fibroids that get pregnant will have uneventful pregnancies. But it speaks to just having a dialogue with your OBGYN. If once somebody with fibroids finds out they're pregnant, they need to have discussions about, what to expect, what to look for, what are the risks involved here, and so forth, that so she knows exactly kind of what she's up against.
Interesting. I've also, I had to try to study as much as I can, because typically men were very selfish, especially when it comes down to the bedroom. And we're very ignorant, and I'll put it out there. It is what it is, right? We're very selfish. We want what we want, how we want it. But a lot of the times we're very unaware. And because we're unaware, we only know the things that happen in our own body. And half the time we don't even take those things seriously, because we could deal with the pain, we'll figure it out, we'll take a Tylenol, we'll take something, and we'll just keep it moving. Right. The female anatomy and the female body and the female mindset doesn't always work in that same facet.
Absolutely not.
I've learned that. It took me a little bit of wisdom, but I've acquired that over time, right? So with that understanding, I know the narrative right now is really based on the women, but I also want to target the men, because I'm sure a majority of these women have some men in their life and they are absolutely clueless as to how to be a support system.
We love when the men come out to our events. I mean, I speak throughout the country on fibroids and have lots of events.
Yes, sir.
And we really appreciate when men come, because, they really need to understand, what their wife, their girlfriend, their mom, their sister, their daughter, what they're going through.
Correct.
To really help provide the support that's necessary. Because a lot of women can struggle quite a bit, not only physically from the amount of blood loss and the heavy periods each month, but mentally trying to push it through each month, the dread, because most of these women that are struggling don't want surgery, but it's the only option they've been given. So they may not be able to afford to be out of work for 2 months with surgery, or afford it, afford the surgery or whatever. So they have to push through. And so there's a big mental toll that it takes on women. And what these women need is support and understanding, from their significant other. And so when, men come out, we love talking to the men about this, because the one simple example I can give you, and I can talk about this case because she went public with it, but when I treated Cynthia Bailey from Real Housewives of Atlanta a number of years ago, she literally said, I gave her life back. And it was, and it was transformational for her. She was having horrific periods. And at the time she was married to Peter, and he couldn't understand. All he knew was he wasn't getting his. And so
they were that selfish factor that we were talking about.
Thank you. I was just about to bring that up.
So he thought Cynthia no longer loved him anymore, which couldn't have been farther from the truth at that time. But when you're bleeding horribly, I mean, she was wearing, adult diapers. You don't feel very sexual. Plus you're anemic from all the blood loss. You're tired, you're fatigued. And so not only are you just wiped out physically, but you don't feel very sexual. And so sex went out the window. And so Peter just assumed, Cynthia doesn't love him anymore. He didn't understand the first thing about what she was going through. And then, she had this straw that broke the camel's back moment when she was at this lovely Bravo event in this beautiful white evening gown. And all of a sudden the blood just rushed out of her. And she was standing in a pool of her own blood. And then Peter recognized the fact that, wow, this is something serious. And she's really suffering with this. And once she came in and she saw me and she had the UFE procedure with us, it totally transformed her life. She got her life back. Her periods became normal. She wasn't fatigued and tired and weak. She didn't need the diapers anymore. She got her regular life back. And as she said, I gave her sexy back. So, all's well and good, but Peter needed to understand exactly what Cynthia was going through, because he didn't get it one bit. All he understood was, well, I'm not getting mine. She must not love me, which was a total disconnect. So you've got to have the communication between man and woman to understand, and men need a lot of education in this area.
And this is why I wanted to bring that up, because one thing that I will always admit is our negligence to learn and be sympathetic. I think that is one of the key factors that a lot of men can work better on. Like I said, we are very selfish and self-driven, especially when it comes down to our sexual needs and our immediate gratification. And we lack a lot of empathy when it comes down to the women and just not understanding the reasons why. Because, the outcome is never the basis of what's going on, right? And if you just give the beautiful illustration of exactly what she was going through. Now, from the public view, nobody would understand this, right? Because, everything's twisted on TV. These people are under the microscope of,
reality shows,
public ridicule, and however the public, whatever sells on tabloids, that's how it's going to be exploited, obviously, right? So the reason why I wanted the men to really get a good understanding is because, again, sexually in the bedroom, men want to be gratified. But however, a lot of women are complaining that they are in a lot of pain doing the sexual process. And a lot of women are trying to express to men, hey, I have fibroids issues, and these are some of the things that come with fibroid issues. And that decreases. I mean, no matter how much you may want the person, if you're in pain, you're in pain. It is what it is. You're in pain, you're in pain. So I really want the men to actually take some time, talk to her doctor, go to her doctor's visits with her, go online. We live in the age of technological information. We have vast amount of information at the tips of our finger. We don't have to go get an encyclopedia anymore. We don't have to go get a med school book anymore. We don't have to go to the library. We can just go right on this things that we're using, our laptops, our phones, and we can acquire the information and how to be more useful. At nighttime, what are some of the small things a man can do to help reduce the pain? Does heating work? Does cold work? Does massages work? What are some of the things that we can do to, we can't alleviate it, but to subdue it just a little bit?
Great question.
Well, thank you, ma'am. I appreciate you. We're trying to be helpful.
Yeah, I mean, there are simple things. I mean, certainly, heat tends to be helpful for the pain, but you know, when somebody's struggling with fibroids, the first line of therapy is usually non-steroidal anti-inflammatory medicine like ibuprofen or
Okay.
Motrin. Um, there are special ones called tranexamic acid, which is often given for people that have heavy bleeding. Birth control will be a
I
common
get
thing.
that.
I heard of that.
It's a common first line therapy. But birth control, as you might imagine, is kind of a double-edged sword. On the one
Yes.
hand, the birth control can lighten flow, which is helpful for these women that are having heavy periods. But on the same token, when I mentioned earlier, the thing that grows fibroids more rapidly than they otherwise would
Great.
is estrogen and
That's interesting.
progesterone. That's what's in a birth control pill. So on the one hand, it can lighten flow temporarily, but eventually it's like pouring gas on a fire. Eventually, it no longer works anymore because the rapid growth of these fibroids overwhelms the ability for the birth control to work. And then the gynecologist says, okay, now you need surgery. And it really boils down to one question. Do you want to have children, yes or no? If the
Wow.
person says no, they say, okay, you don't need your uterus any longer. Just get a hysterectomy.
Ugh.
And if you say you do want children, or maybe or definitely want children, then you get myomectomy, surgically cutting you open, cutting into the uterus and taking out some of the fibroids. And that's the big problem with myomectomy. They never get them all out.
Right.
Sew the uterus back together and then sew her back together. And what I'm here to tell you is that there is this other procedure that we've been doing and is available all across the country. I say we've been doing because we're kind of the leaders in this area. But in the past 25 years, this uterine fibroid embolization procedure has completely replaced the need for surgery for uterine fibroids.
Right. And what is that? Because I know that word hysterectomy is so taboo to women. It's like, oh my gosh, I have to give up a part of myself. And,
Yep.
I have aunts that actually went through that, and it does something to you as a woman. It makes you feel less than yourself. So what is the option that we have now available?
Well, the non-surgical option is called UFE, uterine fibroid embolization. It's performed by interventional radiologists like myself. We're different types of medical doctors. And this procedure is available throughout the country. But as I say, we're at the Atlanta Fibroid Center. We kind of are leaders in this area. But I'm glad you said hysterectomy changes women, because gynecologists will often tell women that are not interested in fertility, no matter what age they are, that they don't need their uterus anymore. And that's just absurd. The uterus has a lot of important functions for women besides just bearing them children. It's important for them psychologically, as you mentioned. It's important for them sexually. There's a lot of bone loss after hysterectomy, urinary leaking. And so we should be more thoughtful and try to keep women's parts. If you have uterine cancer, hysterectomy is appropriate. But as I mentioned earlier, fibroids are benign tumors. So some other facts about hysterectomy. Hysterectomy is the second most common surgery performed in the United States, which is kind of staggering because half the population in the United States and 2 out of the 3 people in this conversation don't even have a uterus. And it's the second most common surgery. And the most common reason why we do it is not cancer, which would be appropriate, but it's for these benign fibroids. And the average age is less than 40.
Wow.
And I was at Tuskegee University talking not long ago, and 3 women came up to me in tears after my talk. My talk was on the Tuskegee experiment of our lifetime, which is this not telling women that have fibroids about UFE. But 3 of them came up to me afterwards. They were less than 30, and I have daughters that age, and all 3 of them had had a hysterectomy. None of them wanted it, but they were suffering so badly, and their doctors kept telling them that was their only option. They never mentioned UFE. And that's a tragedy because, you know, with the average age 39, in a sense, why are we amputating young Black women for benign disease?
Yes.
I have my own theory on that I would disclose at a different time. The moment you had told me the 80% and that we haven't done enough research or invested enough money, I already had my own thoughts.
Right. Well,
Uh,
um, I just give you some more numbers there.
I'll
You know,
take them.
on fibroid research, last year they spent roughly about 14 or 15 million dollars in research for fibroids, which is nothing compared to, you know, the impact that fibroids have on society. $35 billion impact per year.
Wow.
And they throw a small number at it. Based on the number of people that are affected, it comes out to somewhere about 60 cents of research money per individual affected. Now, you take a condition that primarily affects Caucasians, cystic fibrosis. They last year was close to 100 million in research for a condition that affects probably about 35,000 individuals at a cost of research money of over like close to $3,500 per individual. So $3,500 per individual versus about 60 cents per individual. Also, cystic fibrosis has an impact of about $1 billion. So 35 times less of an effect to society, and a much smaller group of individuals garner way more research money. Fibroids is near the bottom. You look at the top 300 medical conditions, it's in the bottom 50 for a condition that affects 80% of Black women. So, you know, this is clearly a disparity that is not being addressed. And as I say, I just did what I could do and made a major gift to fibroid research, but a lot more needs to be done. It can't be just, you know, small amounts here and there. Everybody's got to try to, you know, get after this. There is legislation just sitting in the House and Senate.
Yes.
It's the Stephanie Tubbs Jones Fibroid Research and Education Act. Stephanie Tubbs Jones was in the House of Representatives, and she passed away. But now there is in the Senate, Cory Booker is the lead on that. And in the House, Representative Yvette Clarke from New York is the lead on that. And my rep here in Georgia, David Scott, is one of the co-sponsors. But it's just sitting there. It mandates not only much needed research money for the NIH, $30 million a year for 5 years, which again is not much, but it's something. It also directs the CDC to educate the public and educate physicians about non-surgical treatment options like UFE, uterine fibroid embolization. But it's sitting there. It's just not moving, unfortunately.
Dr. John, I just want to implore you and
yes,
just give you your flowers while you can stay hearing from me. Simply because the fact that you even spoke on those numbers and brought them to light, I really appreciate the fact that you did that. That shows a lot about your character and who you are as a person beyond a doctor, just as a human being, as a humanitarian in this side of life. And the fact that you have dedicated yourself to a cause that doesn't even reflect you, for lack of better terms again, also just validates more of who you are beyond the scope of a physician, just who you are as a humanitarian and a person that just cares about the livelihoods of just people. Beyond the complexion, just people in general. And if there's a problem, then there needs to be a solution to that particular problem, especially when it's impacting such a large amount of particular people. And this whole colorism and color thing, again, that's a subject for another day, because people are people.
right.
And we all need the same medical treatment. When I think about the concept of the medical field and why it was created, the concept behind the medical field before the finances got injected to it, before the insurance took claim of it, before the pharmaceuticals started to eat it up, before big brothers of all different suits and ties started to say, well, wait a minute now, we can't do it for everybody. And this is how we're going to capitalize this on a major stream. And when you just think about, just different ways, I could go back all the way to slavery, Dr. Lipman, with you, and tell you how the medical field has been unjust and how it continues to be unjust in a lot of ways. And I think you see it in your field, and you've verbalized it very well, articulated it extremely well in this regards. Tell us, your center, what is this your particular field of expertise? Is this how you started your medical career? Or is this something that upon studying, upon your journey, you realize, wow, this is my niche, this is my field, and this is where I want to leave my impact. How did we get to here?
Right. Well, I mean, the UFE procedure itself got discovered by accident, like a lot of things in medicine does. We've been embolizing tumors for a number of years. The UFE procedure was discovered in the early to mid 90s. And I had been embolizing other tumors for a number of years. Usually it was a tumor, a cancerous tumor, to make it an easier surgical procedure for the surgeon to remove. When you cut the blood supply off to a tumor, whether it's cancerous or benign, like fibroids, it makes it an easier to take out. And you want to take out the cancer, obviously. So we would embolize these tumors, and then they would go off to surgery. It would make it a quicker operation. And so somebody got the bright idea in France, why don't we do that with fibroids? I know they're not cancerous, but prior to a hysterectomy, we could embolize them and it would make it an easier hysterectomy. So this group in France started doing that. Well, in France, they have a socialized medical care system, socialized medicine, rationed healthcare. So you don't just go right to the operating room. You have to, they were embolized and then they were discharged home. And then they had to wait for their elective surgery because the hysterectomy was elective. So they had to wait for it. And they had to wait because it's all rationed healthcare. So they were sitting at home after being embolized. They're waiting 6 or 7, 8 weeks for their hysterectomy. Well, what happened? When they're waiting for that 6, 7, or 8 weeks, their symptoms started going away. And so they would call their gynecologist and said, you know what? My bleeding's gone. My pain's gone. I feel great. Do I still need that hysterectomy? And when they looked at it, the answer was no. They didn't need the hysterectomy. All they needed was the first part, the embolization. And so the French doctor who was friends with the chief of gynecology at UCLA called him and said, you better look at this. This is pretty exciting. So the interventional radiologist at UCLA at the time was Scott Goodwin, a colleague and friend of mine. And one of the people I named my grant in his honor. He did the first 11 cases in the United States of fibroid embolization, and he was presenting his first 11 patients at a medical meeting that I was at, presenting our data from Piedmont that I was doing. And I'm sitting in the audience going, wow, I know what I'm supposed to be doing now. Because I never would have gone to that conference. I never go to it. I haven't been back since, but I was invited to come. So I figured, okay, I'll go. And I went to this conference, and it was a big conference, but nobody really wanted to hear about embolization. These were diagnostic radiologists. So the auditorium was mostly empty. And so instead of just giving my talk and then walking off stage and leaving, I felt so bad. I sat back down in the audience just so they have another body there. And then Scott gave his speech, a couple of ones after mine. And I'm like, wow, God put me here because, I got the invitation. I never go to this meeting. I would have left, but I was meant to hear that message. And I immediately called my wife. I said, God spoke to me today. I know exactly what I'm going to do the rest of my life. This is an amazing thing. I'm in Atlanta. I could help so many women, and we've helped 10,000 or so women get their life back. And there's nothing more exciting to me than to see these women at the 3-month follow-up. There's lots of hugging, often tears. They're transformed. Their lives are literally transformed back to a normal life. And some of them have even had children. I can remember a woman, she was in her late 30s. when she saw me a number of years, many years ago, originally. And she went to her gynecologist, and the gynecologist said, "You need a hysterectomy." And she was like, "What? Hysterectomy? Is there anything else?" "Nope, nothing else. That's what you need." And she's like, I don't believe this. She goes, and he couldn't understand her reluctance to get a hysterectomy. And she said, "Well, you know, I think I might want to have children someday."
Right.
And he looked at her and he said, "Well, you're 38, almost 39, and you're single. That ship has sailed." And she just couldn't get over it. And I had to apologize for this physician that I didn't know, I never met. I said, "I'm sorry. That's really crass and rude. You know, and I don't know if you'll ever get pregnant, but what I do know, I'm confident that I can help you. And you don't need a hysterectomy." And so she had the UFE procedure, and she did fabulous. She got her life back, and she was really happy with that. And then not long after her follow-up, she had met a man, and they ended up dating and getting married. And lo and behold, they had a child. And she sent me a baby picture that I have in my office if you come to the Atlanta Fibroid Center. And she wrote a really nice, thoughtful note, handwritten note. Thank you so much. You know, my miracle baby, Jalen, you know, I was so close to getting a hysterectomy, and I'm so glad I didn't listen to that doctor. And I'm so glad I saw you and had UFE and so forth. And so that was wonderful and something that I'll never forget. But it gets even better because not long ago, there was a knock at my door late in the day, and my front office staff members said, you know, we're done seeing patients. I'm not sure who that is. And so she went to the door and she came back. She says, "There's a woman here to see you." And so I came out, and it was this woman, and she said, "I don't know if you remember me, but you helped me, you know, so many years ago. And I had the miracle baby, Jalen. And I don't know if you remember that." And I was like, "Oh, sure. Of course I do." And she goes, "Well, I want to show you something." So we walked outside, and the car was parked right in front. Out of the driver's side of the car, Jalen came out of the car. He was driving. He had just graduated high school, and he came to give me his high school graduation picture.
Oh, wow.
So I said, "Come on into my office. You put your picture up next to your baby picture." And so he put his picture right next to his baby picture. I go, "Do you see who this handsome man is?"
Wow. Wow.
I mean,
Dr. Lipman,
it doesn't get any better than that.
amazing.
No, it doesn't get any better than that.
I know, you are amazing. I love that story. And I actually witnessed how much people appreciate you firsthand when we met at the Thanksgiving Turkey Classic with the Georgia Spartans, and Mama Camp was there.
Sure.
And there was a patient that was there that day that just embraced you, and you shared that story with us on the red carpet when we interviewed you. And from that day on, I was like, I have to support Dr. Lipman and Mrs. Lipman with everything that they're doing. So with that being said, with how amazing you are, how you fight for so many people and educates the masses on, you know, UFEs and giving them a choice, why is it that this hysterectomy taboo word for me still gets pushed as often as it does? Why is that?
It's still, after all these years, after 25 years of
Right.
well-proven safety and efficacy of the UFE procedure, every day we see, you know, patients saying, "Well, no one ever told me. No one told me about UFE." Well, they're not, unfortunately.
Wow.
I mean, some gynecologists do, but the vast majority of them, unfortunately, they're surgeons, and surgeons love to operate. And so they will, even though women are entitled to know all the options, not just the surgical ones, most women only get the surgical option. And so there's over 1 million women right now in this country we call the silent sufferers. They just sit on the sidelines suffering with the misery. They don't want hysterectomy, and I don't blame them. So they just suffer through all this misery when we could be helping them and get them their life back. In fact, yesterday I saw that there was an article, and you can look it up in the New Yorker magazine. There is a woman that wrote an article about the anguish she is going through right now with fibroids. And she's facing hysterectomy and doesn't want to do it, but she's suffering so badly and she's already mourning the loss of her womanness, her uterus, before she's even had surgery. She's going through this psychological trauma already. And it's like, hold on. I can help you. Like, of course they didn't mention UFE. She's in Manhattan, in New York City at the New Yorker, that's where she lives. And she has this, expert gynecologist out at Cedars-Sinai telling her that hysterectomy is her only option. And he's the expert, she's looked him up and all this stuff. And I'm sure he's a great surgeon.
Right.
But I'm also sure he's never told her about UFE. There was no mention in this very lengthy, long article about UFE at all. And I'm trying to reach out to her. So I'm hoping I can stop that train. But so often we only hear about these things after the fact. And, no matter what your gynecologist tells you, you do not need a hysterectomy for fibroids. It's an option, but it should be the option of absolute last resort because UFE is so good.
Exactly. So
go ahead, Ms.
I'm sorry. This is what I want, because studies have shown that so many women, I know over 4,000 women, who have had hysterectomy, they're, without the ovarian removal, they suffer a lot. They have things such as high cholesterol that they didn't have before, high blood pressure, irregular heartbeat, heart disease, and later on in life find themselves on the obese side. So I'm just still confused as to why that would be pushed over a UFE when it's so much easier. And as you told us before, that you could have this done and go home the same day.
Right. Our patients go home literally with a Band-Aid. That's it. A Band-Aid at the top of their right leg, or occasionally at the top of their left wrist. But it's a small, regular government issue Band-Aid at the top of their leg. That's it. And they go home with all their parts. They go home with their uterus.
Exactly.
The procedure takes about 30 minutes or so. There's about a 4-hour recovery, and then they go home with a Band-Aid, with a recovery at home of about 5 days, versus this hysterectomy is done in the hospital surgically. So it's an inpatient hospitalization, 2 days, 3 days. And then they go home for a 2-month recovery out of work. And so there is a lot of lost productivity, and you lose an organ you were born with unnecessarily. It just doesn't have to be. You can get your life back. The UFE gets the relief of symptoms, very high success rate, 90% or so. You avoid the risks and long recovery of an operation. We even talk about the risks of, cutting somebody open. You avoid all the surgical risks. You avoid the long surgical recovery. And importantly, you get to keep your uterus.
Yes.
I'll take my own personal non-medical stab at your question. Excuse me, Doctor. Disclaimer, Dr. Lipman has no merit on anything I'm about to say. But I'll take my own stab at your question. When I think about your question, and I'm analyzing all of the data that I'm getting right now from Dr. Lipman, right? And then I'm going to go back to this staggering 8 out of 10 mathematical equation that he threw in my face. And then I'm thinking about, well, if we're going to do anything with this concept of population control, if we're going to do anything of not allowing people, a certain group of demographic people to reproduce, what a better way to do it? I mean, if you think about just the simple mindset of what you're asking, if I can get you to get a hysterectomy, look at the example that he just displayed about the lady went to the doctor and what are you talking about? You're 38, you're 39, and that shit has still the insensitivity behind that mindset, the lack of saying, okay, let's look at alternative options, let's look at natural. It was none of that presented. None of that was presented. It was, let's cut this thing off and just kill your reproductive members, your ability to reproduce yourself or family or create legacy or whatever you look like. We're not going to make more of it, right?
Yeah, so it's the second most common surgery we do in the United States, and the average age is less than 40.
Wow.
You see, Michelle, I get it, right? So yeah, and then also, when I'm thinking about when he did the side-to-side comparison between what his procedure consists of, 30 minutes, 4 hour prep, 5 day recovery, 3, 4 days,
Outpatient.
crazy medical bill, crazy drugs, 2 months recovery bill. Then we got to think about the financial aspect of this too, right? Because remember, everything is big business. So we got to think things
Absolutely.
not just from an emotional standpoint of how we would want to see things play out, but let's look at the financial institutions that's in play. And like he was
Right.
saying earlier, we have to think about all of the laws that are constantly being embarked and passed. Some of these doctors, apart from the privately owned ones, obviously, don't have a say in how they really run their medical practice. You have guidelines in which you're supposed
No.
to follow. And unfortunately,
Right.
if you work in certain facilities that you don't own, and even if you do, they still try to put some pressure on you. You don't really have
Right.
medical liberty to
Yeah.
really do as you know is best half the times. And I can tell you, I have a lot of doctors
Right.
in the medical field, and Dr. Lipman can validate this. In the medical field, they know what, if this person was their family and they were home, what they would have done. But when they come
Right.
into that medical facility, what they're supposed to do and follow, that's two completely different things.
Yeah. Well, fortunately, that's what I say. I I have my own center, the Atlanta Fibroid
And I
Center,
respect
and
that.
one of the reasons why I left the hospital scene was because of the issues you just mentioned. And so one of the things that has never failed me in the 32 years of medical practice is I treat every patient like they're my mom, wife. That has never failed me ever.
Mm. And I think that is one of the greatest things I've heard from a doctor personally, from just a professional, whatever level of capacity that you're at. And again, it goes back to the very first time I just heard you regurgitate the first 2 sentences. I said, "This is a person with a heart," right? And I kept throwing the word humanitarian out to you simply because I see you lead more beyond just the financial benefit in the title. You lead for the sake of you really want to help people. That is your goal. That is your goal. And if you've never had a support in me before, you have a supporter now. I don't care what is it you're doing, because it's one thing to hear about somebody, Dr. Lipman. It's one thing, to carry certain titles and certain stigmas in the community, but it's another thing to dialogue with the person and really see the person for who they are
Wait a
beyond.
minute. I'm gonna
Be
cut you
quiet,
there.
Diamond.
I'm gonna cut
Beyond the
you there.
scope of what people tell you, right? And I'll tell you right now, I don't care what it is that you're doing. I'm going to support your system. I'm going to support what you guys are doing in Atlanta at the Fibroid Center. I'm going to continue to support you wherever you're at. Your foundation, that grant that you're doing, I would love to support that because, again, we need more people to invest in this type of research and these type of treatments, because again, we're hearing the testimonies, we're hearing the benefits of it, and again, it's such an unselfish thing you're doing, which is a radical way of doing it because you're challenging the medical norm. You're challenging what people are saying. Well, this is what you're supposed to do, and this is what's probably more profitable. But you're saying, well, I want to help people. Forget the profit side. The profit will eventually come, but helping people, I think,
Right.
is more profitable than the financial profits. So for
Exactly.
people that don't know how to get plugged in with you and try to figure out some of the things that you've done and where you're located and how they can contact with you and some of the things you do, how do we do that?
Well, the Atlanta Fibroid Center is located in Smyrna, and it's very easy to find me. We have a YouTube channel with the Atlanta If they go to YouTube, Atlanta Fibroid Center, there are hundreds of videos. They can even watch a UFE procedure all the way through,
Wow.
from start to finish. Some people want to watch that. There's all sorts of videos on fibroids and the UFE procedure that people find helpful. Our website is loaded with information. Our website is atlii.com.
Right
ATL.
below.
What's
Right.
that?
I said I have you covered. It's right below on the banner.
Oh, great.
Oh, look at you.
atlii.com. That's great. We have an Instagram page, dr_ my last name. So it's dr_LIPMAN. Those are the easiest way. Or they can just, if they want to just call the office the old fashioned way, 770-953-2600. 770-953-2600.
Yes.
Dr. Lipman, is fibroids and tumors a young woman's game, or does this also impact the older community?
Well, it's mostly young women, and I guess I have to quantify that because I'm pretty old now, so everybody's young compared to me. But you'll start seeing women struggling with fibroids. I mean, rarely in teenagers, but usually it might be come to fruition, or at least they know about them in their 20s, but maybe not symptomatically till 30s, and then peak in the late 30s, early 40s, but we see women even in their 50s struggling with fibroids. So for most women, these are premenopausal women, adult women that are struggling with it. That's the lion's share of it. And it peaks around late 30s, early 40s.
I noticed that, and that's why I wanted to know about the age demographic, because one of the symptoms that captivated my attention was I was trying to figure out, well, why is it that this particular group of women are impacted? Because they fit a certain age group, and it was talking about lifestyle, right? When you live a certain lifestyle, then you have a higher risk of
Correct.
acquiring fibroids or tumors or things of that nature. And then when I'm thinking about, okay, well, what lifestyle, what age would fit this lifestyle? That's the reason I asked the question. What do you have some examples for me by any chance of certain lifestyles that you've seen maybe in your medical practice that produces more people with these fibroids or tumors?
Well, I mean, certainly women that are overweight,
Okay.
either overweight, obese, or morbidly obese, have a much higher risk for fibroids. Certainly, if you're African American, you have a much
Yes.
higher risk. Just racially, I see a lot of African American women in my practice that are not overweight. They're perfectly fit with a very low body fat, but they're struggling with fibroids because they're African American and they're doing all the right things, but genetically it runs strong in certain African American families. So you can't do anything about the genetics, but as we mentioned earlier, the things you can do that will help is try to be as close to your ideal body weight as you can. Try to shed those excess pounds, and then try to have a normal vitamin D level. And if you're low, make sure you get with your doctor and how to supplement appropriately for that.
Correct. So, Dr. Lippman, just to circle back with everything, Dejan brought up from what we discussed in the beginning of who is pretty much at risk for these fibroids, as you've mentioned, and being that we highlighted that, of course, it's more prominent in the African American community or women of color. What do you feel, or globally, that we can do, especially when we see it so prominent in Africa? And, because I'm a
Right.
part of the African diaspora, I'm asking these things because, I see a lot of the doctors that we are in touch with that are trying to assist, in Africa with treating some of these women that are less fortunate. Is that something that you and your center is a part of as well?
Yes, actually, we are. We support a group called Hulu International that
Yes.
supplies sanitary products to young girls in Africa because there's such a dire need.
Yes.
There's such period poverty there. It's very discouraging, and so there's a real need for sanitary products and education, but also we're starting now to really become more global in interventional radiology. So the UFE procedure, which is largely performed in the United States and a couple of pockets in Europe, now there are programs actually that are in place now in certain parts of Africa to do the UFE procedure. So the hope is that we're going to spread the great things that interventional radiology can do to Africa, which has been heretofore largely ignored. I mean, and so there is a big global IR effort, and so we're looking forward to that. The programs are underway. There's one in Tanzania. There's one in Nigeria. and there's a third one I'm blanking on where that is, but it's starting. I mean, at least it's a start, and we need to do more.
Yes, awesome. So how can we, Dejean and myself, and of course the entire Iconic Convo family, assist with everything that you're doing? I know Dejean already spoke about contributing,
Mhm.
just being a part of everything that you have. What else can we do to help with reaching out with the diaspora and everything else to educate everyone, not only nationally, but as well as globally? What can we do to
I
assist?
think the biggest help is to, share the information that we've talked about, um, share the information that's on our website, that's on our Instagram and YouTube channels. Share that information. Our foundation, I haven't accepted any outside money. I certainly appreciate Dejean's offer,
Oh,
um, but I wanted to do this myself so that there wasn't any perception of, well, because other causes, and particularly in the fibroid space, there are a number of fibroid foundations that are solely funded by big pharma,
I
right.
and
got
you can trace the money.
I got
And
you.
so I didn't want to have anything to do with any of that. So our efforts are totally my wife's and my efforts, and we want to keep it that way. But what can be done is spreading the word and spreading the information. Again, there's that New Yorker correspondent today. I mean, every day we read about somebody famous, somebody in somewhere getting, unnecessary hysterectomies. We want to stop that practice. We want to stop the fact that hysterectomy is the second most common surgery. We want to
Right.
stop it for benign fibroids. There's no reason to do this on, young Black women anymore. We have better ways to treat fibroids with UFE, and it's going to take an kind of a global effort to increase the awareness that UFE exists. I mean, it's been around for 25 years. This isn't anything new or experimental in any way. It's well proven, safe, and effective. So there's no reason not to do it. The only reason people don't do it is they've never heard of it, and their doctor doesn't tell them. So that's where you can really help, is just push the information out as much as possible. And hopefully we won't have to have all these conversations about UFE. People will know about it.
Yes, amazing. I have something for you already. And of course, as Dejan mentioned before, getting to know you, because yes, I speak highly of you and Mrs. Lipman.
She does
I
every day.
so love you guys. And I just wanted to make sure that you had this opportunity again, and what any other platform that I'm on, of course, you are more than welcome, because this has to be shared. It's something that I talk about with everyone that I know. Hey, call Dr. Lipman, referrals are there. And
All right.
just to let you know, you said it so many times, I'm going to start using this hashtag whenever I tag you in something. Hashtag Dr. Lipman, get your life back. Because
All
this
right.
this is definitely a life-changing procedure. And as I stated, speaking with my loved ones that had hysterectomies done, it it's a whole emotional roller coaster. It does something to your self-esteem. So with that saying, hashtag Dr. Lipman gets your life back, it will mean so much to so many women. So I just want to thank you on behalf of all the women that you've assisted and those that are tuning in, just hearing that there is an option other than the taboo hysterectomy.
Yeah, and I
Absolutely.
definitely I echo Michelle's statements, simply because as much as we know nothing, right? As a melanated man, I'm thinking I'm in the sun all day. I can be in the sun all day, so I'm sucking it up. So I'm getting it more than anybody else, because I'm out there and I'm able to suck it up. And then today, Dr. Lipman comes in here and says, you're getting less than 10% of
Exactly.
it because of
Uh,
the pigmentation, right?
well, if you're just I mean, I'm unmelanated and
Uh,
I have a low vitamin D. So
well,
um, I clearly spend too much time indoors. I don't get enough
We
sunlight.
need to get outside some more. All right.
Exactly.
But it's just some of those nuances. And I think I love to have a balanced dialogue. And this is why I wanted to interject the men narrative as much as I could, because again, these women, like that New Yorker magazine, she's suffering in silence. But I wonder if there's a man at home and she's still suffering in silence.
Yeah.
Right. Some of the things that, you know, that makes you think, right? So, and I know there's a lot of women, and I've seen it. Like I said, I have 7 sisters, and some of them have dealt with this. My baby sister's still dealing with this. You know, she's in Canada. So I've seen it. I'm experiencing it. I'm living this reality. So for me, this is one of the subjects that I feel like a lot of men really, really need to be more engaged in. There's a lot of subjects that I see a lot of women embark on, but the men need to be there. The men need to be held accountable. The men need to be there just as much as the women, because it takes a community. And it's the funny thing about it is I'm speaking to a man right now, and his whole mission is, and he doesn't even want to take my support because of how great of work he's doing. He wants to make sure he helps. See, and this is what I want to employ the men. Learn how you can be creating impact in your home. This could be your mother. This could be your sister. This could be your daughter. If you really want to get sensitive about this, this could be your daughter. So learn how you can be impactful, how you can help, because that's what it's all about. And Dr. Lipman, I have to really give you your flowers again for all of the work you're doing. I listened to you for the past hour. I can definitely tell you're one of the real ones. You have a heart for this. I saw the teary eye a minute ago. You held it back real good. So I'm proud of you for that. But I really, 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 really want to say thank you for your time. Thank you for the impact. Thank you for the work you're doing. And thank you for your heart in the community, sir. Thank you. Thank you for
Yes,
being on
and
the kind of combo.
thank you for the woman right by your side, Mrs. Lipman, as well, because she does such an amazing job. And you two are such a dynamic couple, and everything that you guys are doing in the community, it's so greatly appreciated, and it does not go unnoticed. So thank you
Yes.
both.
Well,
I mean,
guys,
that's who we serve. That's
all
who we
right.
serve.
Dr. Lipman, any final tools or any final statements for our listeners?
No matter what your gynecologist tells you, if you're suffering with fibroids, you do not need a hysterectomy. It's an option, but please look into UFE.
Thank you, thank you. And guys, there you have it, guys. You just had another episode of Iconic Convo. Please make sure you join us every first and third Monday from 8 p.m. to 9 p.m. with
Diamond,
and Dejean Talk. Thank you, guys, and you have a blessed night. Goodbye, guys.
thank you. Bye, Dr. Lipman. It's been a pleasure.
Thank you,
Yes,
Dr.
thanks. And hopefully we can get on with Nisi. Nisi keeps saying she's going to have me on, so you gotta put in some props for me.
I definitely
You heard
will.
it,
I will
Michelle. Get the
contact
man
my
on with
aunt
Nisi,
as
please.
soon as
Thank
I
you.
get off the phone. I'll contact
Yeah,
my
you got to tell her, like, what's the holdup? I'm waiting on her.
Yes,
I
sir.
keep bumping into her, and she's like, "Oh yeah, I know," but like it doesn't happen. So
Right.
hopefully you'll be the spark that'll make it happen.
Drive it through.
That's the
Absolutely.
one.
And yes, and I'll also contact our sister magazine as well, which is Sapphire Emerald, to get you on that magazine as well, because
Yeah,
that
and
is
I think we definitely need to get him a Hype magazine as well.
Yep. So we have
Most
you covered,
definitely.
Dr. Lipman.
Most definitely. Thank you, Dr.
Well,
Lipman.
thanks
You have a
very
blessed
much. I
night.
appreciate it.
You're welcome,
Have a
sir.
great
Thank
night.
you.